pleurisy, or what referred to as pleuritis, inflammation of the pleura, that is that double-layered membrane that surrounds the lungs and the chest wall. And because of the inflammation, it's going to cause sharp chest pain, and that pain usually worsens, more especially when one is breathing, coughing, and or they are trying to move. Uh, some of the causes of pleurisy or pleuritis, like pneumonia, tuberculosis, pulmonary infection or pulmonary embolism, abscess, upper respiratory tract infections, pulmonary neoplasms, trauma to the chest wall, or a patient who has undergone tracheotomy procedure. Of course, we know when we talk about even the pathophysiology of such a condition, you want to see now there has been an irritation of the parietal pleural. It becomes inflamed or exposure to one of the causative factors. With inflammation of the pleura, then now the pleural space or surfaces get to wrap together, and that's why you get to hear that pleuritic pain, chest pain, which is common with the patient with the pleural pleuritis. In some cases, fluids get to accumulate, and that's going to cause pleural effusion. Uh, of course, this pleural effusion can cause lung compression and dyspnea. And of course, like I've just said, like in cases now when now the pleural surfaces wrap together, now patient gets to manifest with that severe, sharp knife-like pain, which is a key characteristic presentation of a patient with pleurisy. Clinical manifestation, topmost there is the chest pain, usually very sharp, very severe, knife-like stabbing pain. It worsens with inspiration, and also now further worsens, more especially if one is coughing, sneezing, talking, moving, at least doing something, an activity that can put pressure on the chest walls. Usually can be relieved by shallow breathing or lying on the affected side. Intercostal tenderness on palpation, pleural friction rap grating or those leathery sounds can be heard in both phases of respiration, the inhalation and exhalation. Evidence of infection, the fever, the malaise, the increased white blood cell count. Um, um, if effusion is present, then you'll hear dull percussion. Your diagnostics for pleurisy: chest X-ray. It rules out pneumonia, but it also detects effusion. So it will show you that pleural thickening. Sputum examination, which can help you to indicate infectious organism if you suspect that it's an infectious organism that has caused that. Thoracentesis, where you can now obtain pleural fluid for smear and culture. Again, it helps to identify the causative organism. Pleural biopsy, which can be there just to rule out other conditions. You can do the ESR because it's an inflammatory disease. A D-dimer if pulmonary embolism is suspected. Renal function test in case of uremic pleuritis, more especially which has been brought about by patient with kidney problems. So your management, of course, one is to identify the underlying cause and then relieve the pain. So, of course, if there's an underlying cause, primary disease like pneumonia, infection, then you need to manage that. Analgesia effect to the chest wall and also all the other areas that are supplied by intercostal nerves. Complications, of course, pleural effusion can come in, and also atelectasis because of the shallow breathing, trying to minimize or manage the pain. Your nursing assessment, of course, it follows the same pattern. The diagnosis are the same. Um, Interventions assisting the patient to that comfortable position that will promote respiration, that will minimize the pain. Splinting the chest while doing a deep breath or cough just to manage the pain. Administer pain medications. You can make use of the non-pharmacological interventions for pain relief, like applying heat, muscle relaxation, use of imagery. Um, you can assist with the intercostal nerve block if it has been indicated to just administer that analgesic agent. Evaluate for signs of hypoxia. Um, of course, uh, if they are present. Of course, at the end of the day, you expect the patient, of course, not to experience the pain. Any question?